Sovereign citizen and anti-government behaviour is becoming an increasingly complex risk for councils and regulators all over Australia. And traditional approaches to occupational violence and aggression risk management and capability development or training are just not sufficient. They're just not enough. We need a newer, more systems thinking approach. Now, in this presentation, I am going to explain to you the research behind why we need a systems thinking approach and how you can go about doing it. My name is Mark Perrett. I am a career safety, health and wellbeing manager in public sector. I've been in the public sector for around 20 years, and in that time I've worked with local government and state government. I've worked with about 60 councils all over Australia. And I've started researching occupational violence and aggression back in 2019. I've got a strong passion for it. And back then I was at the City of Greater Dandenong, or Greater Dandenong City Council in Melbourne, and I was looking for solutions to the problem of occupational violence and aggression. And because I was completing an MBA, I had access to a university library. So I did comprehensive university library searches looking for any article I could find relating to occupational violence and aggression, particularly anything that was helpful towards solving the problem in local government and regulatory authorities. Unfortunately, I couldn't find a single article that related to regulatory authorities or local government. I found stacks and stacks and stacks, like 80 to 90% of the research which related to the health sector, which is quite different. There was research on policing, there was research on security, there was research on corrections, there was research on education, but nothing on councils or regulatory authorities. So I set out to change that, and I established a research partnership with Monash University and WorkSafe Victoria to conduct research into occupational violence and aggression in local government. Now, we published an article, a systematic review paper in Safety Science Journal back in 2022, which was a result of that research partnership. And that paper has gone on to be the foundation for WorkSafe's new guide on aggression and violence at work. So I'm now going to go into some further work, explanation around the current state of anti-government sentiment, sovereign citizens, and then propose some way forward for you to look at. Anti-government sentiment, the broader threat landscape. Everyday anti-government behaviour. Essentially, that's where most of the OVA risk sits currently. It's just a loss of trust and respect for government. And then we have the sovereign citizen and pseudo-law movements. Now, this is not just a loss of trust or respect of government, but it's a rejection of government legitimacy completely. And it's very fast growing since COVID. And unfortunately, once someone starts to reject the legitimacy of government, we move into a state of lawlessness. And this particular movement, or these movements, they're not really a collection of people. They're people who subscribe to certain ideologies, not necessarily all of them. However, it is very fast moving and is organised. And at the extreme end, we have violent extremism. That is definitely the far end, which ASIO identifies anti-government extremism as an enduring threat. But this is the extreme end. It's not where most of our interactions are at in councils and regulatory authorities. We should not ignore these. Absolutely should not. There is a chance that we can come across it in our work, and the outcomes are catastrophic. So we do need to consider it, and we need to consider it seriously. Most of the controls, however, are with ASIO and police. The sovereign citizen movement is now active in over 26 countries around the world, and it's amplified by digital networks like Facebook and online influencers. Now, I'll get you to bring your attention to My Place Australia for a moment. If you get onto Facebook and you have a look for My Place Australia, you'll notice that there are over 180 different groups around Australia, and there'll probably be one that covers your community or your council area. If you're in a council, there will probably be one. Now, in Victoria alone, the Sovereign Citizen, or My Place Australia, has about 20,000 group members all up across all of the groups in Australia. Now we look at the anti-government, the extreme end of the anti-government sentiment in Australia and sovereign citizens, and we look at the two shootings that occurred unfortunately, where police were ambushed on both times. And we have the Wieambilla 2022 shooting in Queensland, where the trains ambushed police and police were killed there and a neighbour. And then we have the 2025, whilst not an ambush, allegedly Desi Freeman shot and killed 2 police and injured 1 other. Now, both of these extreme cases have strong links to sovereign citizen ideology and conspiracy theories. In the Wieambilla one, originally that was thought to be religious extremism. However, the inquest last year found that it was predominantly sovereign citizen and conspiracy theory driven, whereas Desi Freeman, on the other hand, was quite openly a sovereign citizen. As far as national security threat level, ASIO flags politically motivated violence as a flashing red, and the Lowy Institute calls it is more than beyond a nuisance, escalating into a national security challenge. This is before COVID. Sovereign citizen movements were really just a nuisance. They were a pain. They would inundate councils and regulatory authorities with vexatious claims that were baseless. And it was really just dealing with the nuisance of the overload of paperwork that came from them and the circular arguments. But now it's becoming more violent and more aggressive. The typical demographic of a sovereign citizen, now this is just a typical demographic of a sovereign citizen, this is not the blanket rule. Typically strongholds in regional communities where economic hardship and distrust of institutions fuel anti-authority beliefs. Not necessarily always there though, because I can tell you that if you look through the MySpace website, I recommend you do that. If you look through the MySpace website, I've looked all over Victoria and we can see that southeast Melbourne has a large number of sovereign citizens. However, it also has a large population. Per capita, if you look towards the regions, you'll see that the regions have a high number, but also a lower population. So per capita, the regions have it. Often older men, and it overlaps with anti-vax, far-right and conspiracy movements. Now, I've put together a 2-hour workshop for staff on sovereign citizen OVA training. I also have a full-day training program for staff, leaders and senior executives. Well, the senior executive one is not a full-day training, but the staff and leaders one is a full-day training session, which has the sovereign citizens' risks woven all the way through it. The current state of play of OVA in regulatory roles, and what the data tells us. Now, there's not a lot of research on this, like I said. Nobody is particularly interested in researching OVA in regulatory and local authorities. However, I am. So I'm going to draw on the publicly available People Matter data, or People That Matter reports that the Victorian Public Sector Commission have available on their website. You can look it up, go find it, and you can see all of this. But their research data says that health, education, police and ambulance have the highest rates of OVA. Now, the academic literature across the globe also says that, but there is no literature on regulatory and local authorities to compare it to. But when we're looking, and this is important, when it comes to data, we actually got to interrogate the data and how accurate and reliable it is, and how valid it is, because health, education, police and ambulance have the highest reported rates of OVA. That's from surveys of whole organisations, and these organisations are predominantly customer facing. So naturally they would have higher rates of reported OVA when they are predominantly customer facing, and the customer facing roles have the highest risk of OVA. Most councils and regulators are predominantly non-customer facing. So looking at a typical council or a typical regulator, probably less than 20% of the staff are customer facing. So while health, education, police and ambulance may have the highest rates of OVA, according to the survey data, which is whole of organisation, not drilled down to role-specific exposures, they're around the 25 to 27% of staff experiencing OVA or reporting that they've experienced OVA, whereas in the councils and regulators, they're reporting sort of in somewhere between 7 and 15, maybe up to 17% of staff experiencing OVA. But considering that's only 20% of the workforce, that's quite an alarming figure. But my research, which I've been conducting since 2019, shows a different story. It shows that 60% or more of customer-facing regulatory officers report experiencing OVA in the previous 12 months. Let's also think about how surveys work as well. People who are emotionally attached to OVA and things like this are more likely to complete the survey. So even though it's 60% plus of customer-facing regulatory officers report, the people who didn't respond to the survey may not have experienced it. So it's hard to know. But as a guide, we can say that it's enough to be concerned about. 85 to 90% of the people who did respond to my surveys have reported that incidents were verbal abuse and threats. Less than 2% reported physical violence. It is rare, but not absent. And of those 2% or less than 2% that is reported, it typically leans towards the lower end of what you would call physical violence. No level of physical violence is acceptable, but also we need to understand that it is a continuum from a push or a brush all the way through to violent physical assault. And it tends to be towards the push or shove type thing where they push someone out the door and close the door. But there are cases, and there are many cases, unfortunately, where the violence is quite extreme. 5 to 10% of reported of respondents had said that the cases that they had, the incidents that they had, were serious enough to warrant police action. Now, the biggest thing here is that the staff consistently report that the cumulative effect of psychosocial health impacts were the biggest concern. It causes psychosocial erosion. So it's not so much that one particular incident caused them excessive stress or anxiety or any type of psychological harm. It's the constant exposure to this over time that wears people down. Now, traditional training is not effective. For modern OVA, it never was effective, but in our current context and what we know now, we can honestly say, look, it's simply not effective. And this isn't just me saying that. Actually, the research suggests that too. If you go and look at all the research on the effectiveness of OVA training, most of it is inconclusive or says it's ineffective, and any stuff that does say it's effective relies on confidence levels. Like, there are no real measures of the effectiveness of OVA training other than a person thought that they are more confident to be able to deal with OVA. But when you do the longitudinal study and you come back 6 months, 12 months later, that confidence drops over time. So even if it is effective, it is short-lived. But even then, those studies that said it was effective, the measures of effectiveness are poor and unreliable. Now, some of the problems when I talk to people who have participated in OVA training, the biggest thing that they complain about is, and I'm talking from the context of local government and regulatory authorities because that is my subject matter expertise, that's my focus. They say it's too policey. And being by too policey, as in we aren't police and our role is very different. As local government or regulatory authorities, we're here to serve the community in order to help create health, safety, and prosperous communities. We're very service oriented. We can't come in as if we've got backups. We can't come in a command and control situation. And also, we're not an essential service. We don't have to be there. We can come back, retreat to safety, and come up with a new plan of how we go about our business. We don't need to stay and defend at all costs and come out with a prisoner. Traditional training is often very incident response focused. That's, all good and well. But if we're getting to a stage where incident response is our only defense, we're in a lot of trouble. It's also delivered by outsiders. Now, I'm not going to say that local government or regulatory authorities are special, but I've worked in private industry, I've worked in small business, I've worked in security, I've worked in policing, and I can say local government and regulatory authorities, they are a different beast. They are an absolute different beast. If you want to have effective occupational violence and aggression training for council staff, frontline at-risk council staff and leaders and executives, and in regulatory authorities, same, frontline staff, leaders and executives, you need that training developed and delivered by people who actually know how your organisation operates or how organisations of your type operate, the pressures that you are under, the real world pressures, because we can't look at this as just from an incident response. Like, there is a lot more. The behaviour of staff at the front line is a product of all the other upstream organisational factors. You need to know about all those upstream organisational factors if you are to be able to deliver training that is effective and equips our frontline staff and our leaders and our executives to be able to manage OVA effectively. And this is where we go. It ignores the systemic factors. And it's absolutely critical that we always look at the systemic factors for OVA. Now, but human behaviour is a product of its environment. In organisations, that environment is the organisation itself, the way the organisation operates, and the external environment and how that impacts on the organisation. So if we're going to try and shape behaviour in a positive way in order to make work safer for our staff, we need to look at those systemic factors. So any training that is incident response focused, delivered by outsiders and is policey is not going to cover those systemic factors. And like I say, one-off training, the research shows it has short-term benefits at best. And even then, the measure of those benefits, the measures used in the research is poor. And it doesn't consider primary and tertiary prevention. So incident response and managed situational awareness, conflict resolution, de-escalation and disengagement, that's secondary prevention. We also need to look at primary prevention, preventing that before it happens, and tertiary prevention. What do we do to mitigate harm and restore or recover health and safety and our business continuity after the incident has happened? They are also critically important to how we shape our approach to occupational violence and aggression. We need to move away from the police or security style frontline incident response training to organisational learning and capability development using a longitudinal 70-20-10 approach to action learning. Now, a longitudinal 70-20-10, unlike a single one-off training session, a longitudinal capability development process, action learning, that builds the learning into day-to-day work, everyday work, at the individual level, at the team level, and at the organisational level. We need to move away from relying on tactical controls like body-worn cameras. Now, this is going to be probably hit a raw nerve for a few people, but the research indicates, or at least, that body-worn cameras are largely ineffective at controlling the behaviour of aggressors. They can control the behaviour of the person who wears the camera, and it's great for incident debriefs, but they also have the chance to increase the risk of violence and aggression. Sovereign citizens like to put cameras in your face, but they don't like them pointed at them. We need to move away from those very tactical controls like body-worn cameras to a systems thinking OVA risk management framework. One that gets us not there in the first place if we don't need to be, and gets us out of there before the escalation gets to a point where it's unsafe. Now, I did mention that I did a paper, have a published research paper. This is the one. Factors contributing to work-related violence, a systematic review and systems perspective. Now, we read through hundreds and hundreds of journal articles from around the world. They were largely health because there is nothing on regulatory authorities and local government. But you can see here that I was one of the authors there, and I was at the Greater Dandenong City Council. This was born out of need. And ever since this paper, I have continued to apply this research by developing a suite of tools, frameworks, capability development programs, training programs, so risk profiling tools, safe work planning tools, incident response tools, so before, during, after, all of the and incident investigation tools, all built off this same framework, underpinned by this research. Now, I want to introduce you to the OVA Labs PACER, OVA Risk Management and Capability Development Framework. I know that's a lengthy title, but it's an important one because we look at risk management as one part, as identifying hazards and controlling risks. And then we look at capability development as in building the capability of the humans who do the work so that they can identify hazards and control risks. PACER goes through three lines of defense model or protection. We have primary protection, which is the protecting things or preventing before an incident happens. Secondary prevention, which is largely around incident response or building resilience and adaptive capacity. And then tertiary prevention is mitigating harm and recovering when should an incident happen. And this also looks at business continuity. I've just noticed this is development. That's a good mishap by me. You can see it's not by AI. Anyway, maybe it is. No, it's not. Let's have a look at the OVA, PACER OVA risk management framework as a whole. So we start off at the top. We've got the PACER framework spread out. And then we go down. It's prevention-led, right? So already straight up, it is prevention-led, and it looks at those primary, secondary, tertiary preventions. And it prioritised safety over evidence gathering or enforcement outcomes. Always, no matter what it is we do in councils or regulatory authorities, we have to, if there's a trade-off or conflict between productivity or enforcement and safety must win. We then come back and look at our business continuity processes to be able to look at how do we continue to provide our service under the circumstances. So we're not saying we're not going to stop enforcing, we're just going to step back to safety while we plan. So at the frontline level, we do all of this. The PACER exists across the frontline level, but in the heat of a potential conflict situation where escalation risk is increasing, we have staff who are now starting to go into fight, flight, or freeze. We need to have a simple framework for them to follow. So they're still going to do the planning beforehand. We're still going to have the recovery after. But when it comes down to it, when your heart starts racing at 130 beats a minute, and your jaw's starting to tighten, and you're starting to tremble, and you're fearing, you're scared, but you're potentially you could even be starting to get angry. Depends on who we are and our response to these kinds of conflicts. ACE provides a very simple, straightforward, clear framework that a person can follow while they're under exceptional cognitive load or cognitive strain. Above that level is the team or leaders level. So when we look at this, we say individual level is about the risk management. The front line is the staff. So we're looking at risk management is individual, front line is staff. Team is individual, team is risk management, the leaders are the staff. Now that looks at operations, coordination and continuity. They have controls and communications downwards to help to support and enable safe working at the front line so that real-time decision-making under escalation risk is effective and safe, and they provide feedback up. So this is where it starts to get integrated in an important part of systems thinking. Then we'll go over to the organisational risk level or the executive people level, which looks at safety, systems, safety and resilience at the more strategic conceptual whole of organisational level. Now they have controls or communications which go down to the team leader level or the team and leader level to help guide the operations, who provide feedback up to the organisational level. Now these feedback loops and this structure is really important, and often health and safety falls down because of the lack of these feedback loops, or they might be there but they're not effective. It's important that we get these in place. Let's have a look at the PACER framework with some example considerations across all levels and what this might look like. So the organisational level, at the macro level, it's looking at enterprise risk. I won't read through all of those. You could pause it if you like, so we can see that level there. We're starting to look at governance, horizon scanning for external drivers. Does your organisation have horizon scanning? Do your comms people do social media scans? You probably have social media scans. But what do you do with the information about negative comments towards council and whether it's potentially OVA risk? Do you scan for anti-government sentiment in general? Do you scan for sovereign citizen movements in your area? Possibly good to try and capture. And so, in fact, it is good to try and capture. In the communication, looking at stakeholder narratives, escalation pathways, reputation framing, just identifying strategic levers. Now, this could be we're looking at service suspension and contingency invocation. What we're looking at there is there might be a time where we just decide that not all of our regulatory work is equal, and some of it we might just take the foot off the gas. And an example of that is a lot of councils dropped a lot of their regulation during COVID, particularly around parking, due to the sensitivities and the pressures that were people under. Good move. That's a good example of a strategic suspension or withdrawal of service based on the risk profile. And then it's ensuring that organisational learning loops are investment priorities. Now, these are just examples. There's many more in the work that I've done in the risk profiling tool I've developed. Then we look at the team level. It's more operational around role clarity and building operational capability, building awareness around the current situation and capacity and wellbeing signals, and the triggers to indicate operational stress, internal messaging, escalation handoffs, coordination with partner teams, operational withdrawal and redeployment options. How do we manage that? Continuity trade-offs is important. Like I say, I built a business continuity into this. I worked in health and safety and risk and HR. So this brings together risk, safety and HR into one. That's where there's the OD stuff falls in. So team brief, deculture, short-term wellbeing supports, feeding insights back into planning. And then we look at the frontline stuff, looking at the awareness of environment and role boundaries. This is beforehand. So this is before you show up. We're aware of the boundaries in which we operate and that we're ready to be able to, for escalation should it occur. And then when we show up on site and we're starting to see it, we're looking at the real-time cues and the personal state. This is looking at self-awareness, self-regulation, what to notice and when to call for help. Clarity of messaging and boundary setting, who will be informed. This is just having good communication skills. Keep in mind when the heart's racing and we're under duress, when the situation exceeds safe thresholds and requires withdrawal. And then what do we do immediately after, particularly around a psychological safety and well-being, and then quick and concisely gathering facts and ensuring that it's reported and that organisational follow-up can occur. So it makes good sense. Now this is, like I say, it's just a snapshot. I have a lot more factors to consider. Now so you've got a general idea. Now let's look at the same thing through the lens of sovereign citizen and anti-government sentiment and some of the things that you may wish to consider. Again, these are examples. Looking at sovereign citizen specific risk profiles and protocols and embedding psychosocial hazard controls within health and safety management systems. Being aware of anti-government rhetoric and trend monitoring. This is where, like I said before, if your comms people are doing open source intelligence gathering on your council, your regulator, and are they actually looking for information about sovereign citizen movement and potential health and safety risks for your staff? And also setting up intelligence sharing amongst police, regulators, other councils. Clear public messaging on your legal authority so that you build like a PR campaign, but it talks about your regulatory authority so there's no mistake about it, and setting and establishing escalation and reporting pathways for sovereign citizen incidents. Setting clear thresholds for suspending services or moving some online or looking for alternative regulatory approaches, interagency escalation for credible threats, and then making sure that whenever there's an incident, you're doing systemic reviews. I have a toolkit for this. An AXIOMAP systems thinking toolkit for doing reviews of OVA incidents and then feeding any lessons into policy, resourcing, training, security controls. At the team level, it's more operational. It's about team engagement, pre-engagement briefings. I have a toolkit for how you might do this, systems thinking toolkit, setting up buddy systems if you have it, security support and contingency resources. Setting up behavioural escalation indicators and being clear on those, but also monitoring your team for fatigue, stress, accumulation of psychological strain. This is because people who are stressed, role overload, feeling burnt out, tend to be more likely to be involved in occupational violence incidents as both a victim and an aggressor. So it's important that we look The team leaders are always monitoring for fatigue, stress accumulation, and psychological strain. Should be anyway as part of psychosocial risk management, particularly important as an OVA risk control. Operational coordination with supervisors, legal and police, and consistent messaging on authority limits. This is through internally. Empowering supervisors to terminate interactions, being able to having stop rules, activating backup arrangements, so making sure that if you have your duress alarms and those types of things, that you activate those backup those arrangements. But also to maintain service continuity, because if you have a critical service in your business continuity plan, you also need to be able to have a business continuity arrangement to get that service back up, or the community health and well-being could suffer. And then ensuring that you have structured debriefs after hostile encounters, peer support, EAP referral, and operational adjustments. Now, the framework that I've got for this, I've got a toolkit, not a framework, a toolkit for conducting trauma-informed debriefs, which is also supported by, when the time is right, about systems thinking incident reviews to look at those systemic risk factors. So we have debriefing and learning processes, and then we also have information sharing to feed back into organisational learning to change policy, practices, processes. And then at the frontline level, this is about keep frontline staff when they're doing work. Now I can change. I've set this up as if a person's working in the field. If we were to be looking at a customer service type arrangement or a youth work, we would change this to suit the context. Or a library, for instance, we would change it to suit the context. I have a big list of these things. So we would review site history, behavioural flags. If you have your GIS, you might have some sensitive flags or behavioural flags, and assessing personal safety measures, escalation routes, escalation contacts, making sure that your contacts in your lone worker system are up to date. When you're actually in the contact with the person who you're dealing with, constantly on the lookout to recognising sovereign citizen indicators. They'll have a big list of those. Continually assessing the environment and behavioural changes. As far as communication, this is around self-regulation and communicating in a way to avoid conflict, but if conflict does occur, that you are able to de-escalate it. Now, a big thing that can occur is the ego contests. Now, humans, once we're pushed, for some of us, our response is automatically to fight back. And for some of it, when someone is challenging our authority, and we kind of like our authority, we may push back a little harder than is healthy. Potentially, it's not saying that this is blame workers or anything, but potentially that can increase the risks of violence. So we need to be aware of the impact of ego. Is normal. It is perfectly normal for us to have ego. It's normal for us to have pride. It's normal for us to have honor, but there is a time and place for picking your battle and when to let it get in the way. If you have self-awareness and you're able to regulate and then communicate without ego contest, you are going to be a lot better off. And also how to set boundaries, paraphrasing, and respectful procedural explanations. Because when a frontline staff member, is being bombarded with ridiculous claims of laws that don't exist, and everything, their authority is being challenged, their legitimacy is being challenged, everything they do is being challenged, we just need to have a respectful way of talking about, okay, well, interesting to know, the next step we're going to be doing is, but also offering choices to people. We could do it this way, or we could do it that way. Either way, we're going to be doing it. And we give people choices. That gives people power. So these are some of the things that we can do to help communicate effectively so as to avoid conflict or disengage it if it, de-escalate it if it does occur. And then to exit. This isn't about knowing when to exit. So if we are having trigger points where we would say this is becoming too unsafe and we are going to escalate, and we should be escalating well before there is any sign of physical violence. We are just not there to be assaulted. None of us go to work to be assaulted. We are not the police. We do not have a mandate to stay. We must prioritise safety over evidence gathering, and we must create distance between ourselves and the other people. Always. Now, one of the things that people hear when I talk about this is, but then we've let them win. Well, it's not a game. There's no winning and losing here. Our plan here is that both people come out feeling like they've won. We need to continue to regulate, and the other person needs to walk out safely and feeling like that their ego is intact as well. This is not about winning or losing. We would play the long game to get the outcome rather than push and put our staff at risk to try and get a win now. We are not letting them win anything. And then once the incident occurs, ensuring timely incident reporting with behavioural indicators and psychological recovery debriefing and cumulative stress monitoring. These are all important, and I have toolkits for how to do all of these and toolkits of how to do the risk profiling and spread these out. And each level of the employee OVA development that I have looks at the team at the individual level, the frontline staff. There's a program for team levels and team leaders, which looks at building those skills. And then we have a shorter session, but for executives on good executive sponsorship and what it looks like from an executive level to be creating that system, designing your organisational system as one that enables that frontline capability, your staff to flourish despite the adversity of the work environment that we currently face. That's it for the presentation. I hope you got something out of it. If you've got any more questions, you probably do have a lot more questions. I kept that pretty high level and skimmed through it quite quickly, but I think I gave it enough time. There is a lot more behind this. I've got 7 odd years of research underpinning this, stacks of tools, stacks of frameworks. It's a great system. It's holistic, it's thorough, it's robust. It ticks all the boxes for what a good OVA risk management framework and organisational capability framework should have. If you would like any support on OVA risk framework implementation for your organisation, I can help build your HR safety risk capacity with working with your safety HR and risk people to help them implement the OVA risk management framework. And at the same time, I can help build your organisational capability through delivering training to not only your health, safety, wellbeing staff, HR staff, and your risk management staff, but also providing OVA training capability development to your frontline staff, your people leaders, and your senior executive committee, group management team, general management team, your top level leaders. That's it for me. Thanks for sticking it out this far. If you have, you can check out my website, the OVAlab.com, or it's ovalab.com.au. They both go to the same spot, where I'm loading up a heap of good resources there for people to follow, to pick up and run with. And the YouTube video, keep your eye on this. I've only just started putting all this stuff out into the ether, so keep an eye on my YouTube channel. I'll be posting stuff there regularly, some great content, some micro learnings that you could use in team meetings. I'll be putting up toolbox talks to help facilitate team discussions, and I'll be putting up a whole heap of great information about how to improve different aspects of your system and your systems as a whole to help improve occupational violence and aggression and health and safety risks for your frontline staff. Thank you.